To begin, hello to our friends in Greater Philadelphia, in New York City, throughout the US, and in Israel. My name is Lou Balcher. I'm National Director of AFKMC, American Friends of Kaplan Medical Center. My role is to facilitate this Zoom experience, to set the table, and be mindful of the time. Please allow me to share a few minutes of important information in order for you to get the most out of this session. As Passover is at our doorstep, you could say that I'm watching over the Seder, the order of the gathering. A few thank yous are the first order of the service. Let's take a moment for thanks for the heroes of America, the doctors, nurses, support staff, delivery people, those taking care of our seniors, and all who are allowing us to get through this unprecedented time. Thanks to you, all of our friends on this AFKMC Zoom conference who are committed to Israel and building the American Jewish community. And of course, thanks to our friends and partners who we'll meet shortly. From the Consulate General of Israel in New York, we have the Honorable Yisrael Nitzan, Deputy Consul General. From Magen David Adom, we have Yonatan Yagodovsky, Director of International Relations. From Ben-Gurion University, we have Professor Nadav Davidovich, Director of the School of Public Health. And from Hadassah Medical Organization, Professor Ron Nirpaz, Infectious Disease Physician. And rounding out our group of experts from Rambam Medical Center, Professor Rafi Bayer, Director of Emeritus of Rambam Healthcare Campus. Kindly also bear with me as we recognize key people who made this event possible. After this program is over, these are the ones for you to thank. To our organizational professional partners, I expect your speakers will give us a little information about the wonderful organizations that are represented. From the New York Consulate, Mike Alexander. From Magen David Adom, Rob Rosenthal and Sharon Schmidt. From Ben-Gurion, our good friend Claire Winnick. From Hadassah, Shirley Hoffman and Elaine Weinstein, president of perhaps the largest Hadassah chapter in the US. And from Rambam, Ellen Pomerantz. To our Israeli friends, Officer Netta and Niv and Sigal Nechemia, who you will meet at the end of this program. To the leaderships and professional team of AFKMC, Steve Friedman, our national chair, Professor Jacques Abramowitz, emeritus national chair, and 20 other leaders around the country, including executive committee leaders Yossi Puder, Colonel Ken Bryan, Jerome Baxley, and our Philly guide and friend Joe Zaritsky. I also want to take a moment to recognize Linda Richmond, Emeritus Director of Greater Philadelphia Technion Society, and Vered Nohi, Executive Director of Philadelphia Israel Chamber of Commerce. Once we're able to get people together in person, we plan to honor your achievements. Special thanks to the AFKMC team, Scott, our web whiz, guiding us through the new reality of Zoom meetings, to Jill, Lori, Jocelyn, Steve Goldflam, and Carol, thank you. This is our schedule. Our speakers will give an overview, and we will learn also about the heroes that they are and the critical things that they do. We'll have a discussion among the speakers to go into more depth of the issues of Israel's response to the coronavirus. At the end, we have two personal stories about saving lives at Kaplan Medical Center with Israeli heroes Niv and Sigal Nechemia and Officer Netta of the Lee IDF Unit 669, moderated by AFKMC National Board Executive Committee leader and journalist Yossi Puder. It is understood that if we run a little over 60 minutes, you can discreetly leave, but I promise you the last part will be a real treat. In setting our Zoom Seder table, we need to stop and appreciate that we are living in a paradigm shift. Ways we communicate, interact, how organizations function. It is truly a new world, much like 9/11 changed American society. And this year for Pesach, as we're taught that we should experience Passover as if we were personally coming out of Egypt, this year we can better understand our ancestors of 3,500 years ago as we are in the midst of a global plague, we ourselves. As we begin our Zoom seminar with our esteemed speakers, allow me to welcome the Honorable Yisrael Nitzan, and as it's appropriate in saying Zecher L'Tziat Mitzrayim, Remember the exodus from Egypt? Deputy Consul General Nissan had extensive service for Israel and Cairo. Israel, bevakasha.
Thank you very much, Lou, and the American Friends of the Kaplan Medical Center in Israel, of course, for hosting this important meeting and for your leadership in the Jewish community and non-Jewish, of course, community here. We're here. Well, I'm actually calling from. I'm actually speaking from from within. From inside the consulate. I'm the Deputy Consul General of Israel. We're responsible in the consulate for 5 states. It's New York, New Jersey, Pennsylvania, Delaware, and Ohio. As we say, a taste of the Midwest. Our mission is basically to bring Israel to the 5 states in which we're active. Strengthening our special relations, state level and grassroots level. We're working with state officials. We're working with community leaders in bringing Israel to them, bringing an Israeli added value. And I think that, well, you mentioned my experience in Egypt, in Cairo, also in 2011, when our embassy was attacked. I can say that back then, it was an isolated, let's say that the Egyptian revolution, or what our work as an embassy was an isolated incident. Now this is a global problem. And I think that enjoying and actually appreciating very much the American support to Israel, we're here together in this fight against the corona. And we have a lot to do together and also to share with each other. In Israel, just very briefly, today, I think that we have more than 8,600 confirmed cases of corona, 55, at least according to at least for this morning, 55 cases of deaths, with a very, very strict stay-at-home policy. The government basically approved emergency regulations to reduce the movement of population in Israel in order to prevent the spread of the coronavirus. Those regulations are valid until April 16. There are discussions also regarding if there is any need to exercise, let's say, some more regulations, updated regulations for the holiday of Passover. So basically people are expected to leave, to stay at home, not to leave home, only unless it is absolutely necessary. Now I'm sure that I'm here with professors and experts that I'm sure that they will provide more professional and reliable information about the virus, about the way Israel is fighting the virus, unlike me. People who actually know what they're talking about, and practically fighting the coronavirus and even saving lives. So I'm sure that they will give some more very important updates. What we're doing as the Foreign Ministry and Israel's envoys around the world, we're basically we have 3 main missions right now. First of all, assisting Israelis around the world to come back home. Thousands of Israelis have returned already, thanks to efforts of our diplomats globally. There is also a global effort, Israeli effort, to procure the essential medical equipment. This morning, the first El Al Dreamliner actually landed in Israel carrying essential medical equipment acquired in China. This is the first the first of 11 aircrafts that will bring life-saving protective gear, including masks, ventilators, and additional items from China to Israel. This is a shared project led by the Ministry of Defense and the Ministry of Foreign Affairs, together with El Al, as well as other partners. And in addition to this, we also work in connecting Israel with the US, especially today, creating a community of dialogue between Israelis and Americans. Actually, what you're doing here, Lou, is is such a is a very important effort to basically bring Israel to the United States. A need. We're talking about supporting each other when it's between Israel and the Jewish federations in the United States. Also government-to-government efforts, facilitating conference calls. I will elaborate on this later, as well as basically connecting professionals in both countries, connecting Israeli and American civil society. I think that we have a lot to learn, we have a lot to share, and this is part of our effort again to create and to strengthen our shared values, our very special relations that between Israel and the United States. So I'll stop here and maybe I'll elaborate a little later as we continue the discussion.
Thank you, Israel. Yoni, please.
Well, Magen David Adom in Israel has received a call on, our Director General received a call from the Israeli Ministry of Health on Saturday, February 22nd, in order to place Magen David Adom at the forefront of the activities in a variety of means. It was already clear that in Israel we will be having to deal with people who are affected by the coronavirus because of people that came from abroad with the virus or were infected by tourists that came from abroad and were infected. There was already the revealing of several cases. And Magen David Adom was asked to do several tasks. The first task was to have the teams that will do the swab tests in the beginning at the homes of people with signs and symptoms, and eventually, as we do now, not only at the homes, but also we have opened up, we call them drive and test arenas throughout the country. Some of them are fixed in the big cities, others are moving from community to community in order to swab and take samples and deliver them to the designated laboratories in thousands, in order to provide first the ability to understand and to give the people the knowledge whether they're affected or not, and whether their signs and symptoms mean they have corona or they are, just sick. And on the other hand, make sure that the screening in Israel is as wide as possible, to get the real picture of what is the extent of the outbreak here in Israel. Another thing that we have opened, we have a national system on our national 101 emergency phone number that people in need, in a medical emergency, knows how to call us and reach us, and by that we can activate our system. It is a very a modern system that we have developed over the years, and we opened it up to do the over-the-phone screening according to the guidelines of the Ministry of Health to the entire Israeli public, and according to that to be decided whether they need swab tests or not, and to give them further guidelines. And pretty soon we have realized that with the existing team of about 55 call takers in a shift, we wouldn't be able to respond. Regularly, in normal times, we are receiving about 6,000 to 6,500 calls on our emergency phone line. And we have reached in peak times 82,000 calls from the general public a day. It means that the public is concerned and people need answers. So we have opened up additional locations. We have 500 call takers, all trained to receive the calls. We have trained and received additional team members from the Magen David Adom Reserve Unit of the Home Front Command. We have placed additional call takers from Magen David Adom Youth Volunteers because schools are off in Israel. And we have enlisted additional medical students and trained them to join our swab teams and collect the needed samples from the general public. add to that the regular medical emergency response to people in need, whether they have heart attacks or strokes. Luckily, we see a dramatic reduce in car accident because there's hardly any traffic in Israel, as expressed and explained. And in addition to that, our blood services were requested to do two main tasks. One is to uplift the amount of blood that we store in our facilities in order to make sure that there will be a constant growth in people who are sick with coronavirus. We will soon expect a drop in the ability of the general public to donate blood. And then when people became to recover from the coronas, now we have more than, give or take, about 500 known patients in Israel that already recovered. We call them to come and donate blood to do a process called plasmapheresis. And from their plasma that is rich with antibodies, people might, in severe or moderate condition, hospitalized in the Israeli hospitals, will be able to receive further treatment as what you call silent vaccination, and by that help the entire medical system continue and fight the overall system. We have taken up to now close to 80,000 swab tests from people from all over the country. More than half of them are in the drive and test arenas, and we see a constant growth in it. It's a daily struggle. We are providing the services throughout the country. We have stations also in East Jerusalem, in Bedouin communities in the south, and Arabic communities in the Galilee, in order to provide the best service that we can, and to provide the Israeli medical system the ability to fight and control the spread, the outbreak of the system, and make sure that we have the necessary tools to respond to all the needs of the Israeli society.
Yoni, it sounds like Magen David Adom has a great role in the success of what's happening in Israel. Appreciate that, and we'll hear a few more, perhaps, of the challenges from you a little bit later, and more successes. Let's go now to Professor Nadav Davidovich from Ben-Gurion University.
Hello, everybody. Thank you for having me in this important meeting. So I'm the director of the School of Public Health. I'm myself a public health physician. I used to serve in the military and also was part of the implementation of the international health regulation in the Ministry of Health. So I want to speak about Ben-Gurion University and a bit about my role. So as you know, Ben-Gurion University, like all other universities, moved to online courses. It wasn't easy, and probably we did a leap of maybe 20 years now in online teaching that hopefully will stay with us after the pandemic. We also developed a task force at Ben-Gurion University with many interdisciplinary scientific achievements already. I myself involved in a study about compliance, stress, and its relationship to the trust in the Ministry of Health, together with the World Health Organization European region. We're also working with the WHO about doing surveys of the response of different countries and doing comparisons. So, for example, in our team, we have public health physicians, epidemiologists, virologists, people working on psychology, sociology. So it's really an interdisciplinary team, and we develop a stress measure, now doing 8 measurement, starting from time 0, and this will be very useful also for the next event in terms of understanding compliance of the public. I myself and some other faculty members are taking part in the advising the government, especially the Ministry of Health, including Professor Kobi Moran Gilad from the School of Public Health, who is both a public health expert, but also an expert in the clinical microbiology, and many people that are now in the really small circle of decision-making, like Professor Itamar Grotto, the Deputy Director General, Professor Ran Baliser, who is part of the epidemiology management team, are actually faculty members in the School of Public Health. We are now developing several online courses about global health and pandemics. I myself also now taking part in the task force of the Association of Schools of Public Health in the European regions. And as you can imagine, there are lots of very important decision-making to be made. We are starting now to develop exit strategies in using some modeling, but also, and again, introducing in the modeling different epidemiological, sociological, and even ethical consideration. Just to give you one example, an article that is going to be sent to Science Journal is about one of the exit strategies that if we continue to keep the physical distancing, hygiene, etc., but we can maybe do an alternating work 4 days versus 10 days, and how this will reduce the R0, the coefficient of infection. This is one of the measures that we are now advising for the Israeli government in order to see how after Passover, if the R0 will remain about the same, we can try and bring the economic consideration also into understanding how we can get further with the pandemic. In general, I must say that our perspective that public health, of course, is not just epidemiology. It's not just about hygiene and physical distancing. It's also about issues of unemployment. Every 1% of unemployment raise could lead on the long term to a rise also in morbidity and mortality. And this is leading me to another consideration that we are now dealing with, and this is the non-corona related morbidity and mortalities, because we know that in cases of emergencies, and this is the situation now in Israel, there is a reduction of people going to hospitals and clinics. The reduction now is about 40%, and unfortunately we need to take care that you know, morbidity from and mortality from cerebral and cardiovascular diseases, cancer, and other illnesses will take care. The plan, by the way, now is to take a big part of the hospital. The government is talking about 80% to be corona related, but then we need to see how to move many of the functions that were in the hospitals, including outpatients clinics, and moving them to the community, and also to move them into telemedicine, into house treatment and hospitalization. This is, by the way, like the online learning is probably, I think, will be for greater benefit for the system that anyway was supposed to move in the next decade or 2 decades in terms of shifting from the hospitals to the community. That's something that is, in any case, something that we are dealing in planning the healthcare system. Of course, it's very bad that now we need to deal with it in the terms of the pandemic, but at least we can leverage all these new ideas and models. So just to summarize, Ben-Gurion universities, like all other universities now in Israel, are deeply engaged in developing innovations, new methods, interdisciplinary research, and it's really amazing to see the engagement of all the scientific community at Ben-Gurion University, and specifically the Faculty of Health Sciences, where we are affiliated, of course, with Soroka Hospital, Barzilai, Asuta, but again, not just at Ben-Gurion University, all other places around the country, the sense of solidarity. And maybe last sentence, of course, in the Negev, we have the question of health inequalities. So lots of community engagement, municipalities, civic society, working together with the Bedouin community in unrecognized villages. We're going to the Ramadan right now, and there are a lot of challenges that we need to face, including also with the aging population within the context of what we call health in all policies. So in a nutshell, as you can imagine, we are very busy, but I think that, again, working together with all the amazing people that also represented here from other institutions is a point of strength of Israel in general and Ben-Gurion University in particular. Thank you.
Professor Davidovich, from listening to you, I understand that you are one of the gurus of public health in Israel. We're honored to have you and the other speakers aboard. And for the second round, if you and the others can pick up one item of most importance to share at the second time around. So I understand that Professor Ran Nir-Paz may be having a technical difficulty. If he is on, please join us. If he is not, let's go to, is he on?
Yes, I'm here. I'm here.
Oh, wonderful, wonderful. Okay, shortly, just a brief introduction, what your institution is, what you're doing, a main piece about what you're doing, and then we're going to go into a little bit more detail in the second time around. Welcome.
Thank you very much. Sorry for being late. I was on a roadblock between the hospital and my home, so it took me a bit more than usual to get home because of the quarantine enforced in Jerusalem. So my name is Ran Nir-Paz. I'm an infectious disease physician at the Hadassah University Medical Center. I was also on mission to Japan, looking for the Israeli patients on the Diamond Princess ship. Ever since I came over here, I spent 2 weeks on quarantine, and currently just relates to what we do over here. I'm the consultant for the Corona department on the infectious disease. We conduct several clinical studies for treatments. One of them is a treatment that I got from Japan, and we got just now a preliminary approval from the local IRB for conducting this study. And I'm also busy with a few other groups, also relates to what Nadav is doing, consulting for the Mashlat, the headquarters, in which the support for the Ministry of Health is being conducted. There's also a group of physicists that we doing some preliminaries on how epidemics should be modeled for this disease, and that's really briefly on a nutshell what we do over here, except for doing just a regular job on infectious diseases on the hospital.
Thank you, Professor Ran Nir-Paz. And moderating this, I apologize to Professor Rafi Bayer. We'll get to you shortly, but I know that Israel Nitzan has to jump on to another foreign ministry call. So if you can give us, Israel, if you can give us an update, and then we'll come back to our other speakers.
Yeah, well thank you, Lou. Again, I wanted to give maybe several examples of what we're trying to do here. I think that as a consulate, again, we're the representatives of the Israeli government, and in New York, New Jersey, Pennsylvania, Delaware, Ohio, we facilitate. First of all, we're looking for the opportunities. We're looking for the needs, when we realize what are the needs, we try to look for Israeli solutions. Government to government discussions and government to government engagement is very important. We actually, quite at the beginning of this crisis, already a month ago, we facilitated a conference call between the Israeli Ministry of Health and the New York and the people, the staff of the New York Health Commissioner in an early stage to compare notes, to share best practices because of the intensity and the and of the relations and the travel, especially the travel of Israelis to New York and from New York to Israel. We thought that it could be very useful, and it was actually very useful. We are looking for other opportunities. Of course, we're in touch with the local government agencies, the Commissioner of Health of the city, the Commissioner of Health of the state, as well as within the 5 states. One more example that I can share. This past Friday, we hosted part of our effort basically to leverage the global partnerships. We facilitated a conference call between the Israeli Home Front Command of the IDF and the office, New Jersey Office of Homeland Security. I think that New Jersey and Israel share quite a lot of characteristics, geographic, physical size, as well as the population, as well as the diversity of the population. And in this discussion that was appreciated by both sides, it highlighted both sides highlighted best efforts and best practices to understand the challenge of COVID-19, its impact on society, best practices in emergency coordination, especially vis-a-vis the private sector, vis-a-vis the community leaders, diverse community leaders, as well as dealing with disinformation, the way to share the information with different communities. There are different ways to share information with different communities. I think that we learned that today, especially in these 2 days, when it comes to our effort to basically contain the spread of the corona with certain communities in Israel, as well as cyber threats, for example. So we have a lot to share, and we have a lot to learn from each other. What we're also trying to do is basically to look for opportunities to connect the Israeli civil society, nonprofits that have a lot of experience and connect them with the civil society and community leaders here in the United States. We're doing it through webinars, for example. We're going to host a webinar, several webinars. One is with Israel tomorrow to basically share the best practices of Israel and their work in Puerto Rico. The idea is basically to reach out to our Puerto Rican friends here in New York and Pennsylvania and New Jersey, to engage not only with the Jewish community, but with non-Jews as well, to strengthen our commitment to each other and to learn from each other. We're going to host a webinar with the Dream Doctors next week. The Dream Doctors it's a non-profit, a group of an organization of medical clowns, and they will share their experience with local communities here. We want to bring them to officials, to government officials, but also to community leaders. Again, and what I maybe would like to ask you is if you think that there is any need within, your communities, other communities, diverse communities here in the United States, please let us know. And I'm sure that we can actually, if there is a need, we would like to look for an Israeli solution, an Israeli way to address this need and to solve it, and basically to bring Israel to Jewish and non-Jewish communities, as well as government agencies, elected officials. So we're here to support you as communities, and we're here to support other communities as well.
Israel, thank you so much. I know you have to jump on another Ministry of Foreign Affairs call right now. And what you shared with us is the experts who are sharing what they're doing in Israel. You're translating best practices for us our benefit in America and sharing and learning together. So thank you again. And Professor Bayer, my apologies again. Israel called me earlier saying that he had to jump off. So Israel, thank you. And kol hakavod in all that you're doing, and much strength to you, and Zisn Pesach to you. So Professor Rafi Bayer, with my apologies, please join us and give us a quick introduction. And actually, you can start with a focus, your focus, to start the second round as well.
Okay, great. Thank you. And thank you, Israel, for your note, and everybody. And thank you, Lou, for putting this on. I'm former director of Rambam Medical Center, also former dean of the Faculty of Medicine of the Technion. I'm also I'm a cardiologist and biomedical engineer. Rambam, as you know, is the biggest hospital in northern Israel, a 1,000-bed hospital, covers all the north of Israel. And actually, I was director at the time of 2006 Lebanon war. I started my term at that time. And at that time, after the war, we were attacked by missiles, and we built an underground hospital for 2,000 beds for times of war, not thinking that the next war, big war, will be against the coronavirus. And it's a all new campus. The underground hospital is a parking lot, which actually can be evacuated and turned into a hospital. And when the corona woke up, actually the hospital, which is, by the way, affiliated with the Technion Faculty of Medicine and the Technion Engineering, this really tight collaboration between all of us, took a decision to, number one, first of all, prepare two corona departments called the Keter departments, Keter 1 and Keter 2, and each one for 30 patients of corona, both mild, moderate, and severe cases are actually held there, including ventilated patients. And also, in addition to that, in preparing for the possibility, which I hope will not happen, of hundreds of patients that need to be admitted, we actually turned the lowest level of the underground hospital into a corona underground hospital, which is a sealed department. By the way, it's sealed against chemical warfare, so now it's sealed also for protecting from the coronavirus infection to the outside world. So it's really an amazing shift of the concept. I mean, we were fighting against missiles in 2006. Now we're fighting against an unseen enemy, which actually also has more harm, much more harm, even the missiles that fell from northern Lebanon. But the staff is amazing. The staff at Rambam is fully committed. We turned into 2 shifts, 12-hour shifts, in order to protect the staff. So far, luckily, none of our staff has been infected with the coronavirus. Some of them needed to go to isolation, but none of yet. But it can happen. We know that. I mean, this thing can happen despite the fact that you're trying to do the most to actually protect our physician. We are prepared. We have an additional 50 ventilators that we can use if needed in the future. But if the scenario becomes more, it doesn't look like that it's going to happen. The numbers in Israel are lower than many of the countries in the world, but nobody can know. In the next 2 weeks, we can have a different turn of this curve, and we need to do more. We're also working very hard together with the Technion and with the industry around us for innovative technologies. For example, we use the BioBit, which is, a sensor that you actually patch to the chest of the patient, and this transmits to the computer 24 hours continuous ECG, temperature, oxygen saturation, ventilation. So it really helps to monitor the patients even without the need for frequent access by the physicians, and other novel technologies that from the Technion engineers around us. It's really amazing to see all these startup companies that actually take the forces and convert it into the corona fight, including data analysis and other types of things. So we're all committed, and I think it's really, it's a war. It's a war. It's a world war. But it's really fighting against this enemy. I'm sure we'll overcome it in a few weeks.
Professor Rafi Bar, thank you so much, and thank you for representing the North, because we wanted a geographical representation. We have the South, we have the North now, and I understand, Rambam, is that a Clalit hospital?
No, it's a government hospital.
It's a government hospital.
It's a government hospital.
Okay, okay, wonderful. So I thank you so much. Let's go back to Yoni from Magen David Adom. And if there's like one piece that you want to share with us, a major piece that you can share with us of accomplishments, of something we should leave knowing about what's going on in Israel, please share that with us.
Well, one of the things that our Director General decided to do is to join an innovation team and check a variety of options to deal with the lack of, let's say, the potential lack of the mechanical ventilators in Israel in case it will be needed. And some of our paramedics join a team that includes Air Force specialists from the Army and Rafael and Israeli Aerospace and Robotics, etc., trying to find a solution to the problem with the cheapest and most handy means. And they have developed a system, taking a manual ventilator that we all use in the ambulances and the ERs in any hospital, and they're common and handy, join it with a relatively simple mechanism that provides the necessary volume of each breath and the pressure in order to buy time and to be able to ventilate people. This innovation is already being tested, as far as I know, in Hadassah, in Soratsky in Tel Aviv, Hadassah in Jerusalem, Soratsky in Tel Aviv, and by other agents. It was already placed in GitHub, which is kind of the YouTube of technology, so people can download all over the world the specifications. They can be built in 3D printers and with known materials, so other places in the world can use it. We have numerous webinars regarding that in order to see what can be done. It's a non-profit project that we are very proud to be part of, a huge team of smart people who are developing it for the good and for the health of the humankind all over the world. And it's also, I know, being tested already in a few locations in the US over the last few days. In addition to that is the fact that we know now much better what are the capabilities of our team members, which are mainly volunteers. We have highly trained, more than 24,000 volunteers from the entire spectrum of the Israeli society, that they have their day jobs and they do what they usually do throughout the day. And we are lucky enough that they give us, I don't know, 8 to 16 hours a month of volunteering. Now they're fully enlisted with a team of about 2,400 employees covering the entire country, giving their utmost in order to assist their neighbors, the friends, the family members, and as said by the other speakers, do their best in order to prevent from the families to be exposed because they are outside on the field working and assisting people. We know it is an ongoing struggle. We know it will take time until the medical world will find the proper solutions in Israel. We do hope that we will be able altogether to keep the numbers as low as possible with all the experts that exist in Israel and provide amazing guidance to all of us to cope with temporary lack of reagents or some of other items when we take the swab tests, and mainly assist communities that are in high risk, whether it's neighborhoods, cities, senior citizens' homes, and so on, to be there for each and every one of them. And it's not us alone. It's the state of Israel enlisted together in order to assist every single member of the Israeli society. And if we will be able to assist others, that will be even greater.
Wonderful. Yoni, that's wonderful. The important role that Magen David Adom does, and what you're sharing with us, new technologies, new ways of doing things, and that's tremendous and appreciated. Professor Nadav Davidovich, what kind of major pieces would you like to share with us as we get close to closing out this part of the program?
Thank you. So I won't repeat again many of the current innovation and scientific achievements. I want to focus on the social aspect. And I think that from my perspective, our greatest achievement is that already for more than a decade, we are working with the population of the Negev, different parts of it, migrants, Arab population and the Bedouins, in order to reduce health inequalities and working with the communities. We developed years ago a platform of working groups. And Lou, you know, when you are developing something that is working every day and people know each other, also in when you have an emergency, you can deal with it and found yourself on a much more secure place. So we worked with the Bedouin community, with the leaders there, and I really want to convey the message that the Arab community in the Negev is very compliant. They close the mosques. They announce through the megaphones in the mosque about the proper way to deal. We are now working together just before the Ramadan to see how they're going to comply. And I'm not saying that everything was smooth, but at least we dealt with it in a way of solidarity. And the roundtable that we developed with all the people from the academia, ministries, civic society could work together to develop solutions in order to see how the inequalities between center and periphery can be diminished in order to tackle the current pandemic. And I think this is also in the spirit of Ben-Gurion University in the Faculty of Health Sciences and School of Public Health. We have lots of volunteers from our students, and that's something that I'm very proud, much more than publishing a paper in science, things that we're also doing, but this is real life and the real change, and it's finally about public health and about being human beings and help and be together. Thank you.
Thank you so much. It's amazing what you're doing, what our other experts are doing. And I think one of your key points is the collaboration between institutions and experts. And it's an honor that we have to bring you together here. And I'm just feel so at a loss because people don't want to, aren't used to staying on for Zoom longer than 60 minutes. I'd love to have another half an hour with all of you and go into more detail. But just to finish up with Professor Ron Nir-Paz, if there's a major accomplishment that you can share with, some things that perhaps more about your trip to Japan or whatever, your experience as a direct physician dealing with infectious diseases, an achievement of Israel in that regard. And then when you're done, we're going to switch to the second part. And I appreciate those who want to stay on because I guarantee you it's going to be something very, very special. So Ron, bevakasha.
Second, unmute. Yeah, fine. I'm okay. Thank you very much, Lou. So I'd say that going to Japan was kind of a very unique experience in this time, because I was able to get acquainted to a few things that I was not aware of before. The trip to Japan was in many ways kind of a journey in which in the mornings we were with the embassy team over there, see how hard they work to organize the evacuation of the people back to Israel, while the evenings being a kind of social, but they were dedicated also to meet Japanese teams dealing with this epidemic, also on the hospitals in the morning and also on the labs, and to learn from them how they cope and what they do over there. And in fact, they were in many ways 2 months ahead of us. Although they keep the numbers low, there was a lot to learn from them on how they behave and what they do that makes Japan so different compared to other countries. And major part of the trip was also learning from the Japanese and trying to bring this information back into Israel. And indeed, part of what we've done over there, just to, at that time, it was only the Sheba Medical Center organizing to getting Corona patients. So just, sending information back, asking important questions and bring the information back in, and to liaise with the Japanese to get this information back to Israel, and to make sure that the starting of preparations in Israel will be settled in a way that Israel could be prepared itself better for dealing with this pandemic coming back to Israel. I would like to notify another topic. There's a very important, I'd say, organization being prepared in Israel, and I think it's not really being understood. The Ministry of Health is obviously doing a very important job in this process and trying to bring everything in, but obviously this kind of a process, and as Rafi Biar already mentioned, it is a war. It is a war. So it took time, but many people came in and started to create some kind of innovating establishments to support the Ministry of Health with kind of army-like operations, creating a good intelligence of this war, which is not regular intelligence, but bringing in people from the army and from the Mossad and other organizations like that, and bringing that into a one unit or one establishment that can make a support for the government, and creating, in fact, a completely new mechanism to deal with this kind of war, which is not I'd say it's not an obvious thing to create practically a new establishment, a new organization that will support the country, both getting intelligence and getting equipment and getting swabs, and getting agents, and how to buy all those, where to find those, and then to support the government part, what Nadav is doing with creating models of how the epidemic will prepare, and the government is really comparing all those models coming from academic and army institutions and physicists and mathematicians, computer scientists, epidemiologists, and bringing all those together, and in fact creating practically a new, I'd say, infrastructure for dealing with such a pandemic. And I'm not sure that that was done in many other countries, and by many ways I think it's creating something which is really important from scratch. And this organization of establishing this a group of people together, which is a huge group from all the important units within the government, within the army, within the other organization, and within and from volunteering people, to create a completely new mechanism that can make us as Israel improve and and get better or dealing with better with this pandemic. It should be understood that what's happening in Israel now is a very complicated situation. The whole country is practically blocked. Going from, for example, from the hospital to my house, which is about 1 kilometer, it took me today half an hour because of the roadblocks. And this is not an easy thing. It's you know, if I would walk, it would be faster. But the whole situation now is in Israel is very complicated. The whole situation between different communities, some communities have been hit quite hard with this pandemic, and for infectious diseases, they don't really care about equality and being politically correct. Infectious diseases are not correct and not politically correct. They just attack whomever is more susceptible, and we need to understand that, and that's our way to understand the disease. And sometimes being conceived by this special population as being somebody is humiliating them. So one need to deal with those as well. So it's really a very complicated situation now. We are privileged. We have the ticket that can enable us to go from one place to another, but it's not an easy situation at all.
Right. That was beautiful. You shared with us the personal thing that you just had to go through, which tells what life is like in Israel right now, how it's dealing with it. You also shared with us something essential, which is part of our message. All these experts in Israel working together, developing new infrastructure to deal with what the next threat may be, which may be even worse, but you're already dealing with that. And that might be something that Israel Nitzan is working on and sharing that critical information with America. So I thank you very much for that. For those of you who can't stay, we will go over our 60 minutes. Hopefully it'll be 10 minutes more for our ending part of the program. But again, it's going to be a very real treat. As the National Director of American Friends of Kaplan Medical Center, we have a challenge in that all of you, our experts from Israel, know Kaplan, and virtually very few, unless they're Israeli Americans, ever heard of Kaplan. So we're trying to get the message out of 3 critical strategic values of Kaplan Medical Center for Israel, for the state of Israel, that you probably take for granted in Israel and America does not know. Number 1, it serves more than 1 million Israelis, a major center, the whole center of the country. So it's the health lifeline for the center of Israel, everywhere between Jerusalem and Tel Aviv. Number 2, as Rambam in the north, Kaplan has to be ready for, number 1, terrorism incidents to individuals and being able to save lives that way. And number 2, mass casualty. And Yoni, I remember when we had our pre-program on Wednesday, I mentioned that my work with the Israeli consulate was helpful in getting Magen David Adom on a foreign ministry mission to explain the importance of mass casualty and preparedness. And Kaplan is critical for that strategic part in the center of the country. And Officer Netta will share with us the last piece of what Kaplan is important, because strategically, geographically, it's right next to Tel Nov Air Force Base, where international rescue from Israel originates. So with that, I want to introduce my very close friend, who I've worked with since we were both worked at B'nai B'rith in 1980. So I'm dating us, Yossi Puder, who is on our executive board for American Friends of Kaplan. He's also a noted journalist. Yossi, if you can come on and introduce our final guest.
Well, Sivan is the first one, right?
We're going to Sigal and Niv. And
Sigal, yes, I'm sorry.
Sigal and Niv.
And Netta, right?
And Netta, right.
Right. So the story of, are they on? Let's make sure that they're on.
Actually,
yes, we're here. Yes.
Beautiful, beautiful. So before
here's Netta.
Sigal, let me share a 55-second video. Do you see the video on your screen?
You have to share your screen, Lou.
Okay. Can you share it?
I can try. Yeah, let me try to do mine. Hold on one second. Yeah, I'm gonna find the video. Where it is. Okay. Let's see if this works.
This is Scott Brenner, our web whiz, our technical assistant who makes all these things happen for us.
Are you seeing the video, Lou?
I have the video up on my screen.
Does everybody else see it?
Anyone else see a video? Ready to go?
Yeah.
I see
Yeah.
it. I see it. I
Yeah.
see it.
Yofi. Okay. So this is a 55-second video, which is an introduction to our next speakers. You'll probably remember this. In the center, Niv Nehemia, manager for Supersal in Yavne.
All right, back to you, Lou. Oops.
Okay.
Okay, Lou, back to you.
Okay. So Yossi, we just saw something which many of us remember, and we're honored to have Niv and Sigal, and you had a chance to talk with Sigal last night. So Yossi, if you can do introductions.
Well, I really think that you should do it better. But anyway, I think it's an extraordinary story. Niv is a hero. I think that the media in Israel covered that extensively, but I think that hearing it from his own mouth would be much more effective than me telling the story. So with all further ado, let's have Niv and Sigal tell us the story again.
Sigal, you with us?
I think she is not.
Okay.
So let's go to Netta and let her tell her story.
So before we get to Netta, those of you who just saw this, and there's always technical challenges in these kind of things, but what you saw, the 55-second video, was the bravery of Niv Nehemia, who, after watching this video, after being stabbed 14 times, he continued to go after the terrorist, allowing other shoppers at the supermarket to leave. And for the last 2.5 years, he's been going under treatment, surgeries, and what's even more real of his heroism is the heroism of his wife Sigal, who is taking care of Niv, who's taking care of 5 children, including one that has also serious medical issues. And over the last month, in hearing their story and meeting them, I'm proud to say that I've become a friend of Sigal. And hearing her story, and each time I talk with her, she starts with this big smile on her face. She does all this like the heroes of Israel, deals with life, deals with what's given to them, and does it as a hero and continues life with a big smile on her face. So I hope to introduce you to Sigal and Niv later, but right now, Yossi, I'm going to hand it to you for the next introduction.
Well, and Netta is right there, so let her tell a story. Go ahead.
Hello, everyone, and thank you, Lou, for inviting me. My name is Netta Menashe. I'm 27 years old. I live in Jerusalem, and during these days, I'm finishing my degree in Ben-Gurion University. I joined the Army in 2011 and was honorably discharged in the rank of captain. I was an operation officer of an F-16 fighter squadron, and later in 669 unit. My last job was IDF Executive Director to the President of Israel. I will share with you one of 100 rescue missions I commanded at 669, the Combat Search and Rescue Unit of the Israeli Air Force, one of the 4 elite units and one of the premier special operations units of IDF. The unit squads are ready for action to save lives 24/7. On December 2013, the unit carried out a rescue mission for a soldier who had just enlisted. During the recruitment process in the Bakum, the soldier received a tetanus vaccine just like any other soldier. And after a short time, she was infected with necrotizing fasciitis, and she was evacuated to Magen Hospital in critical condition. We were immediately called to the incident. The mission was to get her to Rambam Hospital into hyperbaric chamber. The mission took 6 hours. I called into action a doctor reserved from the unit who was in Kaplan Hospital at the time and managed to arrive to the Telnof base in 20 minutes. Meanwhile, we organized the helicopter and the equipment and planned the complex mission. The mission was successful, and today the soldier is healthy and all is well. It's clearly visible there is great importance to the arrival of medical teams as quickly as possible because agility saves lives. 669 unit is Israeli only national security rescue service serving as a safety net to all its citizens, both within its borders and beyond, and leaning on great doctors, fighters, young women and men, friends who are family to me till today. All we need is one phone call and we all arrive to the unit and be ready for a new challenge of saving lives. Thank you all for listening. Chag Pesach Sameach.
Thank you.
Thank you, Netta. And actually something else relevant to our conference, you just recovered from something. What was that?
Oh, yes, yes.
Just a simple virus named Corona. 2 days ago I recovered, me and my mother. I think I got it from a Purim party of the university, but right now all is good. It took 3 weeks, but we're totally fine.
And you look wonderful. You look wonderful.
Yes, indeed.
Yeah.
And you're ending with us with a beautiful story, which goes to what we're about, the collaboration of different organizations. Rambam that was on the call, Kaplan right next to Telnof Air Force Base, the critical role that we all work and play together. So I want to thank you all our speakers, our partners, and all who joined us. Your comments to this presentation are appreciated. You can email me at lbulcher@afkmc.org or go to our website, afkmc.org. Best wishes to all for Zis Pesach, for those who celebrate a meaningful Easter. Stay safe. Goodbye. Thank you very much. Toda. Anyone wants to stay after, I'll stay after to chat with anyone for a few minutes. Thank you so much.
Organization, the PLO, in 1963. He was born in 1940 near Jaffa.